Okay. Now again, you're going to be doing single views probably. So remember, we want the long axis of the part along parallel long axis cassette. So if we're doing one-on-one, the long axis is this way. If we're doing two-on-one, the long axis is the side of the cassette being used. Okay, I'm just going to show you the one-on-one depending on where you are. And again, if you have a hard time, pick it up and you just want to just epicondyles centered film approximately. Okay? AP. Small adjustments all you need. Just wherever you can get it in without being in the part. And it's not uncommon for the women, their arms to kind of bow out. You know why?
Yeah.
Get around the hips.
Yeah, that's not that right.
We understand. You're outnumbered here.
But not outclassed. Okay, so and there's the AP elbow. All right? Very simple.
And he exposes us all. Hey.
Now again, when you're changing cassettes, it's very easy just to pick one up and slide it under. All right? Okay, now from here it's very easy, just like you were going to do, have them turn their hand palm down. But you got to be careful because you can get carried away with it.
I could pull my sleeve up. All you had to do was ask.
But I can demonstrate. Eventually. I'm about to pull a button off here.
5 years later.
All the help.
Nope. Okay.
You asked too late.
With the arm out straight, if you just gently pull it, it puts the arm at a 45-degree oblique. But the problem is from there, because the hand's not going to move, but you can still do all that.
Mm-hmm.
See, so simply by turning the hand down, you make sure they don't roll the arm too.
Okay.
'Cause- so
So just leave your elbow, move
just
your
leave the
hand.
elbow and just rotate the hand. Right? Because it's quite common. Well, I had the hand palm down, but yeah, it's an internal oblique. So, with it from the AP position, just tell them to turn their hand palm down, and all you want is the elbow about 45 degrees. Okay? Table's going to move. With the rooms that you're using, the overhead tube makes it so much easier than fighting with this pedestal-mounted tube. So there is the, which oblique is this? Internal or medial. Okay? Remember, all the obliques are in reference to midline of the body. Am I turning toward the midline or away from midline? Toward midline, internal oblique. Remember. Yeah. Now anatomical, it'd be toward the medial aspect, but when we do obliques, we don't go to. We describe the obliques as far as the relationship to midline of the body. Okay? Chapter 1 stuff. All right? Now, for the external oblique, this is the one that gets a little bit of problem. This is where it's usually easier to have them stick their arm out and lean back. If you just try to roll the arm back, it wants to stop right there.
Yeah, that's not fun.
No, so let's stick the arm out, and you have, there's a lot much easier in this.
Yes.
Okay? So again, just remember arm out. Remember with the arm in front of you, you have a 270 degrees of rotation. With your arm out to the side, you have 360 degrees rotation. Palm up, all the way, palm up. But in front, you have palm up and thumb down, 270 degrees. Okay? So remember for the lateral, just stick the arm all the way out to the side, and just have lean back. And again, then just, again, I've limited this machine. Okay, there you go. Okay? So again, try to keep your 4 sides of collimation so that the machine will...
Ladies and gentlemen, you want to make this exposure quick.
Yes. Yes, you do. Relax. Yes. That's it. Yeah. Well, it's uncomfortable. But again, if you have trouble doing that, I know I've had occasions where the patient, for some reason, can't do that. So, there's another way, but I'll show you later. Okay.
Tape them down?
No, you have them stand up. All right? Or, if they're really that bad, Okay? You could leave the cassette flat and then you can angle the beam.
Yeah.
Question is which way? Okay? So remember, lean away from me. So with it straight like this, if you can't angle the body, go back flat. So you'd angle medial to lateral, and you would give the appearance of the oblique.
That's advanced.
You've
That's only in the
you've
4-year
never,
program.
you've never seen Mickey do that?
No.
I've seen him, it's a lot in ER though.
Yeah. And
Yeah.
you use the same concept when we do lateral extremities too. If you
Ooh,
can't
yeah,
get the
that's
part
right.
lateral, then you angle to make it lateral. Okay.
Nice.
Now going back to lateral, again, you have to put their arm form 90 degrees. Okay. Wrist up to a lateral position.
And you angle the beam 5 degrees?
Say again.
How far do you angle the beam from the? If you did it.
You kind of want
Well,
to
you would
angle
have
your
to-
wrist back just a little.
If the arm is totally flat, you'd angle 45 degrees.
Okay.
Because it's supposed to be a 45-degree oblique. Okay? Now on that oblique, don't call out the answer. I want everyone to think about it for a second. On the external oblique, will that free the radial head or will it superimpose the radial head from the ulna?
I'm thinking 3.
Okay? There's radial head, it frees it. If I go internal, it superimposes it. Okay? So start thinking along those lines.
And don't get your marker too. I had a problem with getting my marker too close and it gets in the soft tissue. So don't.
And on the elbow, it's important, because, and in the wrist because of fat pads. Okay? All right, so there is the 4 views of the elbow. All right? Now I'm going to go ahead and show you the humerus. Okay?
With the lateral elbow, where were you centering at?
You center on the epicondyles.
Okay.
Mid, well, it says epicondyle, but you want to center mid-mass. So if I was centering her, I'd just center there.
Okay, so you found the epicondyle and the center.
Yeah, just midpoint between the epicondyles.
Okay.
So olecranon process, anterior surface midpoint. Even though both's going to say center, and again, you're ½ inch difference. So
Yeah.
The beam's pretty straight.